Cancer can hide in plain sight, silent, deadly, and often ignored. But what if your body is already trying to warn you? In this video, we reveal 12 warning signs of cancer you should never ignore. Your awareness today could save a life tomorrow. Let's begin. Sign 1. Unexplained weight loss. Have you been losing weight without changing your diet or exercise routine? This could be an early warning sign of cancer. Unexplained weight loss, especially if you lose more than 10 pounds without trying, can be a sign that something serious is going on in your body. Cancer cells can use up a lot of your energy, and they may also affect how your body absorbs nutrients from food. This can lead to sudden weight loss, even if you're eating normally. In cancers of the stomach, pancreas, lungs, or esophagus, unexplained weight loss is often one of the first noticeable symptoms. Sometimes this happens because tumors cause changes in metabolism, or they release substances that alter how your body uses energy. It's important to remember that weight loss can also happen with other health problems, like thyroid issues or diabetes. But when it's sudden and has no clear cause, it's time to see a doctor. So if you're losing weight without trying, don't ignore it. Listen to your body. Early detection can make a big difference. Sign number 2, persistent fatigue, when rest doesn't help. Fatigue is a common complaint, especially in today's fast-paced world. But when tiredness becomes persistent, lasting for weeks or even months without improvement, despite proper rest, sleep, and nutrition, it can be a red flag, especially when there's no clear reason for it. This kind of fatigue is not just ordinary tiredness from a busy day. It's deep exhaustion that interferes with your daily activities, making even simple tasks like climbing stairs or concentrating at work difficult. You may feel physically drained, mentally foggy, or emotionally low, and this feeling doesn't go away with sleep or relaxation. Why is persistent fatigue a warning sign of cancer? The body uses a lot of energy to fight cancer, even in its early stages. Some cancers produce substances called cytokines, which interfere with normal cell processes and cause exhaustion. Others, like leukemia or lymphoma, actually crowd out healthy blood cells, reducing oxygen transport and causing constant fatigue. In cancers like colon, stomach, or pancreatic cancer, fatigue may also come from internal blood loss that's not immediately noticeable. Over time, this leads to anemia, a drop in red blood cells, resulting in tiredness, weakness, and pale skin. According to the American Cancer Society, fatigue is one of the most common symptoms reported by cancer patients, even before diagnosis. The National Cancer Institute also notes that cancer-related fatigue feels different from everyday tiredness. It is more severe, lasts longer, and isn't relieved by sleep. When should you be concerned? You should see a doctor if fatigue lasts more than 2 weeks without improvement. It's accompanied by weight loss, pale skin, or unexplained pain. You wake up tired even after a full night's sleep. There's no obvious cause like stress, illness, or overwork. Final message: persistent fatigue is your body's way of signaling that something deeper might be wrong. While many causes of fatigue are harmless or treatable, it should never be ignored if it becomes long-lasting and unexplained. Detecting cancer early can save lives, so listen to your body and act when it whispers, not when it screams. Sign number 3, persistent pain. Persistent or unexplained pain in the body can be an important early warning sign of cancer. While not all pain indicates something serious, pain that doesn't go away, increases over time, or has no clear cause should never be ignored. Let's break it down. Pain is the body's natural way of signaling that something is wrong. In many types of cancer, pain may occur because a tumor is pressing on nerves, bones, or other organs. For example, a brain tumor might cause a headache that won't go away, or a tumor in the spine may lead to back pain. According to the American Cancer Society, bone pain is a common symptom in cancers that have spread to the bones, such as breast or prostate cancer. Also, cancers such as pancreatic or colorectal cancer can cause abdominal pain, which may be dull or sharp and persistent. Ovarian cancer may cause pelvic pain. The key is the persistence. If the pain is ongoing for weeks, not responding to regular painkillers or gradually worsening, it needs medical attention. Another example is testicular cancer, which can present as pain or discomfort in the testicles or scrotum. Similarly, a chronic sore throat or pain while swallowing could indicate throat or esophageal cancer. Experts emphasize early detection saves lives. Persistent pain might not always be due to cancer, but it's a sign your body is giving you. It's always better to investigate early than to delay. Ignoring pain or masking it with medication without finding the root cause can allow cancer to grow silently. In summary, any long-lasting, unexplained pain, whether it's in the head, chest, abdomen, back, or elsewhere, should be taken seriously. Always consult a doctor to rule out the possibility of cancer. Sign number 4, persistent pain, a warning sign of cancer. Persistent or unexplained pain in the body should never be ignored, especially if it lasts for weeks or even months. While pain can have many causes like injury, arthritis, or infection, long-term pain without a clear reason may indicate something more serious, including cancer. For example, constant headaches that don't go away with treatment could be a sign of a brain tumor. Ongoing back pain might be related to cancers of the spine, colon, or even ovaries. Chest pain that persists could be linked to lung cancer. Similarly, pain in the bones may point to bone cancer or cancer that has spread to the bones. According to the American Cancer Society, pain is often one of the first symptoms of cancer when the tumor presses on nerves, organs, or bones. In some cases, pain may also result from inflammation caused by the cancer's growth. Let's understand it with logic. Our body uses pain as a signal that something is wrong. If there is an internal growth like a tumor, it can press on nearby tissues, nerves, or organs, triggering chronic discomfort. Unlike common pain that improves with rest or medication, cancer-related pain keeps returning and may even worsen over time. Real-life reference. Pancreatic cancer is known as a silent killer because it causes very few symptoms early on, but one common sign is persistent abdominal or back pain. By the time this pain is recognized, the disease may have already advanced. So if you or someone you know is dealing with unexplained, ongoing pain that doesn't respond to usual treatments, it's crucial to consult a doctor. Early detection can save lives. Remember, not all pain means cancer, but persistent pain without a clear cause must be investigated. Sign number 5, difficulty swallowing or persistent indigestion. Difficulty swallowing, also known as dysphagia, and persistent indigestion are often overlooked, but they can be important warning signs of cancer, especially cancers of the esophagus, stomach, or throat. Let's break this down clearly. What is difficulty swallowing? It means you feel pain or obstruction when trying to eat or drink, especially solids like bread or meat. It might feel like food is stuck in the chest or throat. This happens when tumors begin to grow in or around the esophagus and press on the walls, narrowing the passage. According to the American Cancer Society, persistent swallowing problems that do not go away should be checked by a doctor because they are often linked with esophageal or throat cancer. What is persistent indigestion? Indigestion is a feeling of fullness, burning, or discomfort in your upper abdomen, especially after eating. Most people feel this occasionally, but if it's happening regularly without a clear reason, it's a red flag. It can be caused by a tumor in the stomach lining or upper digestive tract, interfering with normal digestion. Medical logic. When cancer begins to grow in the stomach or esophagus, it affects how your body moves food through the digestive system. This disruption leads to long-term indigestion, bloating, or even vomiting. Why you shouldn't ignore this sign. While indigestion and swallowing problems can be caused by other non-cancerous conditions like ulcers, acid reflux, or infections, if the symptoms are persistent, lasting more than 2 to 3 weeks, and getting worse, they need medical evaluation. Early detection could save lives. In summary, if someone is frequently struggling to swallow food or experiencing ongoing indigestion without an obvious cause, it could be a warning sign of a serious problem like cancer of the esophagus or stomach. Don't ignore, get it checked. Reference: American Cancer Society, Mayo Clinic, National Cancer Institute. Sign number 6, changes in the skin, a silent signal of cancer. Changes in the skin may seem like a minor cosmetic issue, but they can sometimes be a warning sign of cancer. Skin is the largest organ in the body, and it often reflects what's going on inside. When cancer begins to develop, especially skin cancers like melanoma, basal cell carcinoma, or squamous cell carcinoma, your skin may show unusual signs that shouldn't be ignored. One of the most well-known signs is a changing mole. If you notice a mole that starts to change in size, shape, or color, it's important to get it checked. Dermatologists use the ABCE rule to identify signs of melanoma. A for asymmetry. One half of the mole doesn't match the other. B for border. Edges are irregular or blurred. C for color. Varies across the mole or includes unusual shades like blue or black. D for diameter. Larger than 6 millimeters, about the size of a pencil eraser. E for evolving. Any change in appearance or new symptoms like itching or bleeding. But it's not just moles. Other skin changes can also signal cancer. For example, persistent itching, bleeding, or scabbing spots on the skin. Darkening or yellowing of the skin, also known as jaundice, can indicate liver or pancreatic cancer. Redness or scaling, especially if it's not improving with treatment, may be a sign of underlying skin cancer. In some cases, skin changes can also be linked to internal cancers. For instance, acanthosis nigricans, a condition where the skin darkens and thickens, often in folds like the neck or armpits, can be a sign of stomach or liver cancer. Another example is paraneoplastic dermatosis, rare skin rashes caused by an immune response to an internal cancer. According to the American Cancer Society, detecting skin cancer early, especially melanoma, can significantly increase survival rates. When caught early, melanoma has a 5-year survival rate of about 99%. But if it spreads to distant organs, that rate drops drastically. In conclusion, never ignore changes in your skin. Whether it's a new growth, a changing mole, or an unusual rash, your skin could be trying to tell you something important. Early detection saves lives. So if something looks or feels wrong, get it checked. Sign 7. Changes in lymph nodes, especially persistent swelling. One important warning sign of cancer is swelling or enlargement of lymph nodes, particularly when the swelling does not go away for several weeks or continues to grow. Lymph nodes are small, bean-shaped structures that are part of the lymphatic system and play a vital role in fighting infections. However, when these nodes become enlarged without any clear infection, or they stay swollen for a long time, it can be a red flag for cancers such as lymphoma, leukemia, or even cancers that have spread from other parts of the body. For example, lymphoma, a cancer of the lymphatic system, often begins with painless swelling of lymph nodes in the neck, armpits, or groin. In contrast to swollen nodes from common infections, cancerous lymph nodes are usually harder, fixed in place, and do not reduce in size over time. According to the American Cancer Society, persistent lymph node enlargement without a known infection or injury should be evaluated by a healthcare provider because early detection greatly improves treatment outcomes. Another point to note is that leukemia, a blood cancer, can also cause lymph nodes to swell due to the abnormal buildup of white blood cells. These swellings may not be painful, which often leads people to ignore them. In summary, if you notice a lump or swelling in your neck, underarms, or groin that stays longer than 2 weeks, keeps growing, or is hard and painless, don't ignore it. Get it checked by a doctor. Early action could save your life. Reference: American Cancer Society, Signs and Symptoms of Cancer. Mayo Clinic, lymph node swelling, when to see a doctor. Sign number 8, persistent cough or hoarseness, a silent signal of cancer. If you have a cough that just won't go away or your voice has become hoarse for more than 3 weeks, this could be a red flag, not just a seasonal allergy or a lingering cold. Persistent cough or hoarseness can be an early warning sign of lung cancer, throat cancer, or even thyroid cancer. Let's understand why this matters. Normally, a cough caused by flu or infection resolves in a few days to a couple of weeks. But when a cough lasts longer and is dry, gets worse over time, or is accompanied by blood, it's a sign something more serious might be happening. In lung cancer, tumors in the lungs can irritate the airways, causing chronic cough. Similarly, cancer in the larynx, voice box, or thyroid can press on vocal cords, leading to a change in voice or hoarseness. According to the American Cancer Society, hoarseness that persists for more than 2 weeks, especially in people who smoke or have a family history of cancer, should not be ignored. This is because cancers in the respiratory tract or throat can start small, without pain, and slowly grow while showing only voice-related symptoms. It's also important to note that thyroid nodules or tumors can press on the windpipe or vocal cord nerves, leading to voice changes or difficulty breathing. That's why doctors recommend a throat examination, imaging tests like CT scans, and possibly a biopsy when such symptoms persist. Logic is simple. Our body uses symptoms like cough or hoarseness to alert us. When it doesn't go away with common treatments, it's a message that needs deeper attention. So, if your cough or voice change lasts more than 3 weeks, gets worse, or comes with other symptoms like weight loss, fatigue, or shortness of breath, consult a doctor. Early detection can make all the difference in cancer treatment. Sign number 9, unusual bleeding or discharge. Unusual bleeding or discharge from any part of the body can be a serious warning sign of cancer. This symptom should never be ignored, especially if it occurs without any known cause or persists over time. For example, coughing up blood may be a sign of lung cancer. Blood in the stool might indicate colorectal cancer. Unusual vaginal bleeding could be a warning sign of cervical or uterine cancer. Blood in the urine may signal bladder or kidney cancer, while nipple discharge, especially if it's bloody, can point toward breast cancer. The logic is simple. Cancer can damage blood vessels or tissues as it grows, leading to internal bleeding that appears externally. As tumors invade nearby areas, they disrupt the normal function of organs and tissues. This leads to discharge that is not typical, either in appearance, quantity, or frequency. According to the American Cancer Society, unexplained bleeding is one of the key symptoms that must be reported immediately to a healthcare provider. It may not always mean cancer, but it is often one of the earliest signs the body gives when something is wrong. Ignoring this symptom could delay diagnosis and treatment. Therefore, if someone experiences bleeding between periods, after menopause, in urine, stool, or from any body opening without a clear reason, they should consult a doctor right away. Early detection can make a significant difference in cancer treatment outcomes. Sign number 10, changes in the mouth, sores, lumps, or white patches. If you notice unusual changes in your mouth, such as persistent sores, lumps, or white or red patches, this could be a warning sign of oral cancer. These symptoms are especially concerning if they do not heal within 2 weeks. Let's understand the logic and reference behind this. The human body has a natural healing mechanism. Most small injuries inside the mouth, like from accidentally biting your cheek or brushing too hard, typically heal quickly. But if a sore or patch lingers, it means your body is unable to repair the tissue. This persistent irritation can be a sign that abnormal cells are growing, possibly cancerous. According to the American Cancer Society, oral cancer most commonly appears as a sore on the lip or in the mouth that does not go away. It may also show up as a lump, thickening, rough spot, crust, or an eroded area. White patches, called leukoplakia, or red patches, erythroplakia, inside the mouth or on the tongue can also indicate precancerous changes. People who smoke or chew tobacco or drink excessive alcohol are at higher risk. In some cases, human papillomavirus (HPV) infection, especially HPV type 16, is also linked to oral cancers. A sore throat, hoarseness, or difficulty chewing and swallowing along with these symptoms increases concern. Therefore, if these signs persist beyond 2 weeks, it's essential to see a doctor or dentist immediately. In summary, any sore or patch in the mouth that doesn't heal in 2 weeks should not be ignored. It could indicate abnormal cell growth, possibly oral cancer. Tobacco, alcohol, and HPV increase the risk. Early detection saves lives, so always pay attention to what your mouth is telling you. Reference: American Cancer Society, oral cavity and oropharyngeal cancer signs and symptoms. Sign number 11, changes in the mouth, a warning sign of oral cancer. If you notice persistent changes in your mouth, like white or red patches, sores that don't heal, or unexplained bleeding, it could be an early sign of oral cancer. These symptoms are often painless at first, which is why they can be overlooked. However, their persistence is a red flag that should not be ignored. White patches in the mouth, medically called leukoplakia, And red patches, called erythroplakia, can indicate abnormal cell growth. According to the American Cancer Society, these lesions have the potential to turn into cancer if left untreated. Especially if they last longer than 2 weeks, professional evaluation is critical. Sores in the mouth that don't heal within a normal time frame, usually 2 weeks, may also be indicative of cancerous activity. Normally, minor injuries or ulcers in the mouth heal quickly. If they persist, it means something more serious could be interfering with your body's natural healing process. Another warning sign is unexplained bleeding in the mouth, not caused by brushing too hard or biting your cheek. This kind of bleeding, especially when it occurs repeatedly, might suggest that cancerous changes are occurring in the soft tissues. You may also notice lumps, thickened areas, or difficulty in chewing or swallowing. According to the Mayo Clinic, these symptoms can signal cancer of the oral cavity or throat and should be addressed by a healthcare provider without delay. In short, if you observe unusual changes in your mouth, such as persistent patches, sores, bleeding, or discomfort, don't wait for them to go away. Early detection is key in successfully treating oral cancer. Regular dental checkups and self-examinations can play a life-saving role. Sign number 12, non-healing sores, a silent but serious cancer warning. One of the most overlooked yet dangerous signs of cancer is a sore or wound that does not heal. Normally, when our body gets injured, like a cut or an ulcer, it goes through a natural healing process. But when a sore remains open, grows, bleeds, or becomes painful over time, especially in the mouth, skin, or genital area, it may be a sign of something much more serious: cancer. Why non-healing sores matter. When cancer is present, especially skin cancer or oral cancer, the abnormal cells disrupt the body's ability to repair tissue. These cancerous cells grow uncontrollably, outpacing the body's immune system and normal healing. This is why the sore doesn't close, because it's not just a wound, it's a symptom of underlying disease. Logic and medical explanation. Medical experts say that if a sore doesn't heal within 2 to 3 weeks, it should be checked by a doctor. According to the American Cancer Society, one of the early signs of oral, skin, and even genital cancers is a persistent sore. For example, a mouth ulcer that won't heal could indicate oral cancer, especially in people who smoke or chew tobacco. A sore on the skin that bleeds, crusts, or doesn't go away could be a sign of skin cancer, like basal cell carcinoma or melanoma. In the genital area, non-healing sores can point to cervical or penile cancer. Real-life application. Imagine you accidentally bite your cheek or cut yourself shaving. Normally, your body repairs that damage in a few days. But if the sore remains for weeks, keeps returning, or changes in color, it's not just an injury, it's a signal. Your body is telling you something is wrong, and ignoring it may allow cancer to grow silently. Final message. If you or someone you know has a sore that refuses to heal, do not delay. It may seem harmless, but early detection saves lives. Always consult a medical professional to rule out cancer. Remember, not all non-healing sores are cancer, but many cancers start this way. Stay alert, stay safe.